welcome to everybody. I decided to take some liberty, as Linnea said, with this particular topic, and I renamed it, actually. And instead of talking about new discoveries in botanical medicine, I decided that I would talk about the new discovery of botanical medicine. I'm offering my perspective on this because I've been working as an online educator now for about 10 years, an entrepreneur, and have seen a lot of changes in the field of botanical medicine. And I've been evolving along with that, trying to keep up with a lot of these things. So I think that I may have a few points to offer in terms of how we might interact with people, if nothing else, and some of the issues that are coming up. So I wanted to start with just a very brief historical overview of what's happening, because I think it's a renaissance, a revival of herbal medicine that's accelerating with huge social impact. And I think it's probably fairly accurate to say that the last time that herbal medicine was really in the public consciousness was in the early 1900s, and then it went out of vogue with the development of allopathic medicine. But then the clinical level is knowing what works for us individually, all right? And this includes diet and includes herbs. And I'll just give a simple example here, like immune boosting herbs. Everybody's been going for the immune boosting herbs, but the transitional level, the starting level with this is, oh, I should take some immune boosting herbs. The transitional level is, okay, now I have a pharmacy of all these different products that I found online that claim to be the best. But the clinical level where we have to help people get to is, which of these are actually high quality?
We need the big picture, and all those things are true. Ask the questions, do the investigation, consider yourself, the practitioner of yourself. I think I like that idea of the self-care practice. And in doing so, I've come back to, this is new discoveries. So I thought, what a great thing to, go around and come back to where you started. And when I started outside of herb school, I was in College Park, Maryland at a shop, and I met Jim Duke and went to the rainforest with him. And if anybody knows Jim, Dr. James A. Duke, you can imagine what a life-changing experience that was for me right out of herb school, meeting the doctor and traveling with him to Peru, to the Amazon. Here's some sources. Again, all my friends that have written books: David Hoffman, my teacher, Jill Stansbury Buhner, Lisa Ganora. Those are the ones that I know and trust, and that are herbalists and know this field. And please have a look at their wonderful information and sources.
And I'm going to share my screen. I'm going to talk about first, herbs are not drugs is kind of a label, a concept. And it kind of goes along with what David was saying about, and Teresa also mentioned it about elderberry and the cytokine storm. I don't know whether you tuned into that controversy on Facebook and other venues, but it was really quite interesting to me that that you can even think of a food like elderberry. In Europe, elderberry is very commonly used as a food and in drinks. When I was over, I've spent quite a bit of time in England and on the mainland of Europe. And everywhere you go, like in stores and so forth, one of the main drinks that you can find is elderberry juice. But herbs work in many fundamentally different ways than drugs. And this looks a little daunting here, but I'm just going to go over it briefly. These are my main points, and then I have some more details, which I might skip over some of them just in the for brevity. We don't have a lot of time, but you can access these points in this PowerPoint on my website. And and I have lots of other handouts and so forth on there as well. So herbs work with the body, and they're not really as forceful as drugs. And I'm going to go into that. 40 to 50 million people in this country take herbs and drugs together every day.
Yeah.
This is a fact. And yet how many, if you comb through the literature, how many actual case reports do we have for herb-drug interactions? Very, very low. So I just wanted to say that.
Thank you, Teresa and Chris. Wonderful to be on this venue with you. And my closing thought is this is a very exciting time to be practicing botanical medicine and studying botanical medicine.